Well, welcome everyone. My name is Dr. David Kessick. I am the medical director for the Columbus Division of Fire, and I would like to welcome you to our 12th annual Cardiac Arrest Survivor Celebration. We're so glad that you're here on a somewhat of a rainy day, but we are here to celebrate life. And I think that once you leave here today, you will really feel just so good about what you've heard and how we're going to show you how precious life is once you're given a second chance. It's certainly a wonderful thing to be standing up here looking out over all of you and seeing folks that have been impacted in the most profound way by our EMS system sitting with their rescuers. I mean, it is just a wonderful thing to see. So thank you for coming today. This is the 50th anniversary of EMS here in the city of Columbus. And we actually have the forerunner to our medic vehicles here, the Heartmobile, that I believe is parked outside. If the weather breaks, you might have a chance to go out and actually see that vehicle that used to be the only vehicle we had to treat cardiac arrest victims. And now we have a sophisticated, high-quality EMS system here in Columbus that is doing good work each and every day. So before we begin, I'd like to introduce some of our very important folks here that have been here to honor our EMS providers. So let's start out on the very far left. President Mark Seymour, the president of the local here, 67, who's given us this place to have this wonderful event. Beside him is Dr. Eric Cortez, our associate director, medical director. Our fire chief, Kevin O'Connor. Our director of public safety, Dr. Ned Pettis Jr. Our director in the mayor's office, Kim Perfect. Angela Pace, who will be our master of ceremonies today from 10 TV. To my right, the Reverend Ellsworth, who you've met. Council member Mitchell Brown with City Council. And then we have a whole bunch of white shirts up here. And what that means, especially if they have a bunch of bugles on their shoulder, is that they are all assistant chiefs and very much supportive of what we do here in EMS. So that would be Chief Cannell, Chief Ballard, Chief Happ, and Chief Blair. So we're very honored to have them here today. And so without further ado, I would like to introduce our keynote speaker to you today. Director Kimber Perfect works in the mayor's office, and she'll tell you about what happened to her, but I think that you'll see that she has a very unique perspective in terms of what we're celebrating here today. So would you please join me in welcoming Director Perfect?
Thank you, Dr. Kessick. And wow, what a great sight this is. Welcome, everyone. Chairman Brown, Director Pettis, Chief O'Connor, and other invited guests, thank you for having me here this morning. And to the survivors who are here, welcome. We're so glad you've come, and with your families, we're glad you're here. And to all of our first responders in the room, thank you, thank you, thank you from the bottom of all of our hearts. So nearly 2 years ago, without warning, I suffered sudden cardiac arrest while walking back to my office. I was just a few short blocks from where we are today. The fact that I'm here with you today is a classic case of what the first responders in the room refer to as the chain of survival. Fortunately for me, I was on a busy street and a bystander walking behind me, Stefano Todaro, dialed 911 immediately. You've all heard the saying, right place, right time. Well, if this cardiac event was going to happen outside of a hospital setting, I could not have been in a better place than at the corner of Pearl Alley and Gay Street. There could not have been a better person than Stefano to happen to be walking right behind me. "We need you now. A woman has collapsed. We need you now," he said to the 911 operator. Second best thing to happen to me That morning was firefighter Matt Snyder, who answered the call in the fire alarm office. He immediately dispatched Engine House 1, but firefighter Snyder also sprung into action, asking the caller numerous questions about my condition. Is she breathing? Does she have a pulse? Are you noticing any discoloration? I have listened to that 911 call, so I've heard every word that was said by these two men that helped to save my life that morning. When Stefano said that I was starting to turn blue, firefighter Snyder said, someone needs to start compressions now. Can you do that? Put your phone on speakerphone. I can talk anyone through this. He did not even wait for an answer. He just kept speaking to whoever was on the other end of that line in a calm but firm voice, basically saying to anyone who could hear, you can do this. You don't need to know CPR to save this woman's life. Listen to me. I can talk you through this. Firefighter Snyder, the second person in my chain of survival, calmly coached Stefano and a bystander on hands-only CPR. Those compressions during the critical first few minutes of my event prior to the arrival of EMS played a crucial role in my survival. Firefighter Snyder is here with us today. Please stand and be recognized, Matt. Right time, right place, right there. Thank you, Matt. So next, we have Fire Engine 1 arriving on the scene. But you need to know that firefighter Snyder had also said to whomever was listening, go help flag down the EMS vehicle. Let them know where you are. Someone, I do not know who, heard him because it was later reported to me that a man with a muscle shirt and shorts stepped out into the middle of Gay Street, stopped traffic, and flagged the EMS to where I lay lifeless on the sidewalk. This anonymous person and the bystander who kept administering the life-saving compressions on my heart during those critical first few minutes prior to the arrival of Engine House 1 both played a role in my survival. Right time, right place. Now, Stefano, because he gave his number to firefighter Snyder, he and I have talked. So I've actually had the opportunity to personally thank him. And by the way, he wanted to be here this morning, but he was transferred to St. Louis. And he said, oh, I'm so sorry. I don't think I could take the time off work. And I'm like, oh, please. I would never expect you to drive from St. Louis. But you need to know, when I went to call him about today, I found him, of course, in my contacts. And underneath his name and his phone number, it simply says in my contacts on my cell phone, saved my life. So we are now at about the 10-minute mark of my event. And there are many, many, many more people in my chain of survival. So I'm going to try and speed this up a little bit. Fire Engine 1 arrived on the scene and took over from the bystanders who had come to my aid. I had no pulse and I was not breathing when they arrived. They were shortly joined by EMS 13 and EMS 10. A portable AED was used 3 times to get my heart going again. I was intubated, an IV was inserted, and the medics put a pneumatic vest on me to keep the compressions going. With the precision and care of a well-trained and well-equipped Division of Fire, these medics and firefighters rushed me to Grant Hospital, where I, once again, suffered sudden cardiac arrest. Now, I'm here to tell you that without everything they had done for me in that emergency response, you know, their expertise, their equipment, you know, I'm not an expert. Well, maybe now, some of us are. But I don't believe I would have survived without every single thing they did before they transported me. I honestly don't. And I know there was a broken rib in the process too, which I'm very grateful for that broken rib. So next up in my most important chain of survival, my medics, Captain Miller, Ethan Heigl, Dave Daly, Caleb Baker, and Aaron Tyron, and also responding was Lieutenant Todd Gritter and Captain Aaron Renner. And I know Captain Miller is here. Would you please stand and be recognized? And if any others that I named are here. Renner, Captain Renner, please recognize Captain Renner. So, next up in my chain of survival, Columbus Police Bike Patrol Officer Fletcher Farr. So he was on the scene to assist in any way he could and immediately notified my colleagues in the mayor's office. Captain Miller had noticed I had a city badge. So he called the mayor's office where my colleagues sprung into action, including the difficult task of notifying my family. Officer Farr, about 10 days after my event, I had the pleasure of meeting him at the Pride Parade. And he didn't look at me like he was seeing a ghost, but I have to tell you, he was a very happy man to see me alive and well at that parade. Officer Farr, I know you're here. Please be recognized. Thank you, sir, for being here this morning and for taking the time. So, I also want to recognize Columbus Police Sergeant Rich Weiner, who, when he heard about it, he rushed to the hospital, and he was really helpful to my family going back and forth from the emergency room. So back to Grant Hospital, where I wish, Angela, I could say I was done with my story. But it does continue. Once again, I was revived, this time by emergency medical personnel at Grant, also with an AED. But I'm not out of the woods yet. In fact, when my family arrived, they were greeted by the hospital chaplain, and they were taken into a small room with just a few chairs. And they really, when they arrived, they didn't know if I was alive or dead. And nobody could tell them. So Dr. Arnold Good was the cardio doc on call that morning, and I'm really appreciative of him and all that he and his team did, because I know from Sergeant Weiner that they fought hard to bring me back, and it was not an easy task. I now have had the opportunity to see that cardio doc, Dr. Good, on a number of occasions, and every time he sees me, he tells me, I'm among the luckiest women alive, and I look at him and I say, that's because I'm alive because you were on call that morning. So I'm so appreciative. Right time, right place. And I am lucky, and I know it, and forever grateful. So I wish I could name all the hospital personnel who helped me, but I would like to call out Kunu. And Kunu was a cardiac intensive care nurse, and she is so kind and loving and patient. You know, for those first few days, I repeated myself a lot. I kept asking the same 3 questions over and over and over again. And one of those 3 questions that I asked the most was, who had my dog, Precious? And, you know, it wasn't just a couple times a day, it was like 100 times a day I would ask this question. And so, then meanwhile, my family, who had gotten some respite from Groundhog Day happening in my room, they were out in the reception area, and they noticed I was liking things on Facebook, so they took my phones away from me. I had 2 phones with me, my work phone and my personal cell, because I was, working when I collapsed. So they've got my phones, they're in the reception area, probably trying to take a nap or whatever, and then all of a sudden my sister gets a voicemail from a phone she doesn't recognize, and she picks up the voicemail, and it's a voicemail from me asking who has Precious. So 5 seconds later, 5 seconds between the 2 calls, there's another voicemail from me, who has Precious? So my daughter goes running back to my room, and I'm laying there in my bed, and my eyes are closed, and I'm resting peacefully, and my hand is resting on a phone that Kunu had given me. Because Kunu, who had to take this abuse the most from this patient of hers, she knew I needed some peace, and she gave me that phone. So to this day, though, I just want to close that little story. When my family comes over and I happen to say, well, where's Precious? I see, them starting to twitch. So I'm looking for my dog at the house. But that takes me to family. And I know many of you, probably all of you know, that 70% of sudden cardiac arrests happen in the home. So I want to encourage any of you who are out there and are not trained in CPR to do so, and encourage your friends and your other family members to do so. Of the hundreds who suffer from sudden cardiac arrest each year in this community alone, your loved ones and I are among only 10 to 12% who survive. Sudden cardiac arrest is the leading cause of death in the US, but this is a statistic we can do something about. With the life-saving interventions I received on that most spectacular June morning 2 years ago, I lived to see another day, just like many of you in this room. And all of us survivors here this morning, we are living proof that being completely fine 1 minute and keeling over the next does not need to lead to death. With more people understanding how easy it is to get involved and spring into action, like that small village who assisted me on that sidewalk that morning, the more lives that we can save. Thank you.
Thank you, Director Perfect. I think that you'll find a common thread from her story to the stories that you'll be hearing soon, in that there are so many people involved in the resuscitation of a cardiac arrest victim. And so to that point, on the survivor tables, you're going to see a box. I don't know, do you see the box? Hold that box up. Yeah. All right, good. So I'm taking the official authority here to deputize all you survivors to take that box and teach hands-only CPR to your family, your friends, your neighbors, people you don't like, people you do like. And really teach them, because early CPR and early defibrillation are the two most important things for survival in sudden cardiac arrest. So we're giving you those kits. You're officially deputized as hands-only CPR instructors to teach everybody that you can. So be aware of that. All right, I do want to recognize one of the funnest things that we do every year here is the honoring the previous honorees, or recognizing the previous honorees. So when I call your name, would you please stand, starting with Kimber Perfect, Warren Altoff, Carolyn Summerich, Ralph Wood, Carolyn Miller, Mark Bradford, Sylvia Blanchard, Wanda Wells, and we did lose one of our honorees, Dick Abruzzi, this past year. Can you join me in giving them a round of applause, please? It is always great to have them come back here so we can just remember them and see how they're doing, and it's always just an encouragement to us. So thanks again for coming. Well, now we're going to go ahead and move into our recognition of our current survivors. And we have been so blessed and honored to have with us for the past, I don't know how many years, one of the true treasures of Columbus, someone who easily recognizable on the street, although I think maybe some people have misrecognized you as other individuals, as if that's possible. But our dear Angela Pace is here to serve as our Master of Ceremonies. Now, Angela graduated probably from one of the most notable academic institutions, really in this region, South High School. But anyway, she is just so nice to come here and provide us with just the honoring our survivors. And she has a heart for this. She wore red for heart today, which also happens to be Marion Franklin's colors, which is where I graduated from. So we've got 8 survivors here today, and each and every story I think will really touch and warm your hearts, and just show how valuable our EMS system is. And so without further ado, would you help me welcome Miss Angela Pace.
Every year I say I ain't doing this no more because of him. And I did wear red for the survivors and for the occasion, but also for Dr. K and Marion Franklin. But I also wore my South High Bulldog pin just to kind of even things out, because I was really afraid I was going to go straight to hell if I just wore red for you. So there. Before we get started, and I'm just so glad to be here again, and I don't know how many years I've been doing this, Dr. K. Forever and ever. I recognize some of the survivors out there, so apparently I've been here for a couple of years anyway. But before we get started, I want to recognize my good friend Kim Perfect, because when Kim had her event, as she calls it, I think she had just left a meeting that we were at together. So it was one of those surreal moments when I found out what had happened, and every time I see her, we're on a board together, and every time I see her, I just want to squash her up, just because I'm so happy that she is still with us. I also have to recognize my favorite man of the cloth, and that's Reverend Ellsworth here. He's been the chaplain, I think, like since probably before I was born. Thank you, Reverend. And I want to make note of the fact that he's got this little blue bag on his table because Reverend Ellsworth was one of my 20 finalists for the 2019 Jefferson Award this year. I think we should applaud him for that, for all the wonderful volunteer work that he does in our community, and he rushed off from the ceremony last month without his goodie bag, so I thought I'd bring it to him today because I knew I was going to see him. So congratulations to you, Reverend. This is always, as I said, one of my favorite things to do because, and I've said it before and I'll say it again, I love me some firefighters. I love firefighters. I don't know what it is about you guys that turns me on, but I love me some firefighters. And even when I was a young reporter on the streets, it was like, okay, go talk to the police, okay, go talk to the Coast Guard, okay. But I love talking to some firefighters. And some of my favorite drinking buddies are firefighters. So I just want to say that that's one of the reasons I say yes to this, because I get an opportunity to hang out with firefighters. So there. Did I say too much, Doctor? I'm sorry. And Chief, Chief Connor doesn't know what to do with me. See, Chief Pettis, he's used to me. Mitch Brown, he's used to me. Chief Connor looks at me like, and why is she here? Why couldn't we get like a real person, a grown-up to do this? Why does she just keep coming back? But I just want to say happy EMS week, happy EMS celebration, happy cardiac celebration again. One of my favorite things to do because it recognizes what I think is probably the best unit in the country, and that is the men and women of the Columbus Firefighters Department and all you folks out there who save lives every single day. Yep, there you go. I live in Clintonville, so I live near Station 19, and I tell those guys every time I see them, just remember where I live. Yeah, just number, address right here in your head. Just keep it there, tattoo it on your sleeve, whatever. Okay, so we're going to get started now. We're going to honor these people, recognize and say thank you for still being here to these folks who are here with us today, our most recent cardiac survivors. On September 5th of last year, EMS 13 responded to a cardiac call, and when they arrived at the scene, they found Eldon Haynes in the basement of the home. Family member was performing CPR. Now, the crew immediately took over the chest compressions, administered oxygen, and connected the LifePak heart monitor. The crew shocked Mr. Haynes. Whenever I have to say that, it's just so disturbing. The crew shocked Mr. Haynes at 200, 300, and 360 joules while continuing CPR. The first change in rhythm came after the fourth shock, a double sequential defibrillation at 360. The result, the return of spontaneous circulation, or ROSC. Mr. Haynes' heart had gone from ventricular fibrillation to atrial fibrillation with rapid ventricular response. Changing tactics, the crew switched the monitor settings to synchronize Mr. Haynes' heart rate and cardioverted him at 50 joules. The crew called in to the OSU Wexner Medical Center, informing the staff there that Mr. Haynes' 12-lead ECG revealed a STEMI. Mr. Haynes was taken directly to the cath lab for treatment and placed on ECMO. Mr. Haynes, could you please join us, along with the crew from EMS 13, Medic 16, and Engine 16. That's Lieutenant Todd Gritter, Lieutenant Jesse Moore, Firefighter Zach McGee, Firefighter Joshua Farley, and Firefighter Joseph Spann. Please all come forward. Mr. Haynes, would you like to say a couple of words? Just a couple. No, come up here. Come up here. No, this is my show. You do what I tell you to do now. All right. I like an obedient man.
I'm just not used to speaking to a bunch of people, but I can't thank you guys enough. I'm here, and I get to see my family. I get to dig in the dirt. I'm a happy man.
Thank you. Yes, you have my permission to sit now. Thank you. I think I scared him. I'm so sorry. Thank you, Mr. Haynes, and thank you, firefighters. When medic crews arrived at the ballroom in the Hilton, they found bystanders performing CPR on Mr. Dana Burke. Crews took over CPR, confirming that there was no pulse. While maintaining minimal pauses and compressions, the crew connected the LifePak quick combo pads and checked Mr. Burke's heart rhythm. Once they determined that the rhythm was ventricular fibrillation, medics preloaded the heart with continuous chest compressions and shocked Mr. Burke at 200 joules. After 2 more minutes of high-quality CPR, there was a return of spontaneous circulation, and Mr. Burke was breathing on his own. En route to Mount Carmel St. Anne's, the crew performed a 12-lead ECG. Mr. Burke returned to a normal sinus rhythm without any ST elevation. The hospital reported that Mr. Burke had severe triple vessel coronary artery disease. Severe triple vessel coronary artery disease. So, would the crew from EMS 12, Medic 28, Engine 28, and Dana Burke please come forward? Lieutenant William Young, Firefighter Warren Spear, Firefighter Gary Childers, Firefighter Ronnie Young, Firefighter Nathan Allwine. Please come forward. Mr. Burke.
First of all, I'd like to thank God. And I'm here. It's not that easy, but I'm doing well. I've had surgeries. Keep things right. And I do thank the gentleman. I thank the hospital. I thank you who's come today. And I thank the survivors to give everybody encouragement to move on. Thanks.
Tell you, these stories just get better and better. Thank you, Mr. Burke. Responding originally to a difficulty breathing call, the crew was met by a resident who didn't even know that anyone had called 911. Ms. Donna Bias was found downstairs and prepared to be in severe respiratory distress. Medics say she appeared to be alert and was sitting upright in a chair, but her breathing was clearly fatigued and shallow. Ms. Bias's skin was cool, pale, and drenched with sweat. She was having extreme difficulty trying to speak between breaths. As the crews were getting their equipment together to treat Ms. Bias, she passed out. A pulse check confirmed that she had gone into cardiac arrest. The quick-acting crew immediately started high-quality CPR. The first rhythm check revealed that Ms. Bias had pulseless electrical activity. After 6 minutes of CPR, the crew found a carotid pulse. The crew continued to assist with her breathing with high-flow oxygen and a bag valve mask. 2 minutes later, Ms. Bias was in the squad, headed to Mount Carmel St. Anne's. A 12-lead ECG showed a right bundle branch block. By the time they arrived at the hospital, normal respiration had returned. Would Donna Bias please come forward, along with the crew from EMS 12, Medic 29, and Engine 29, firefighter Dale Barnhart, firefighter Jeffrey Ross, firefighter Kimberly Barton. Please come forward.
I'm just going to read the letter that I had sent to the substation about 6 weeks after this occurred. My name is Donna Bias on July 7th, 2018, which happened to be my 60th birthday. I had to call 911 for myself for life-saving assistance. It was about 5:30 a.m. I made the call to 911. The 911 operator stayed on the phone with me and verbally relayed to me where the ambulance was until it got to my home. The paramedics and firemen had to tap on the bedroom window on the back end of the house to wake my husband up to unlock the front door. I was in too much distress to yell or unlock the front door to allow them to come in. The paramedics and my husband came down. I answered 2 questions and then went into cardiac arrest. The paramedics did 2 minutes of CPR, got a pulse, but in the driveway, my pulse was gone again, and they did another 4 minutes. I was rushed to St. Anne's Hospital, and then the ER treated me for acute pulmonary embolism. I do not know who the paramedics were. I just wanted to say thank you for saving my life. I was within minutes of dying, and their quick action saved my life. I have a husband, 3 children, and 8 grandchildren that I was not ready to leave on this earth, and these paramedics, with God's hand, made sure it did not happen. Please make sure that this letter finds them all, so they know that what they do every day matters so much to me and my family. I have been told by all the physicians and hospital workers how lucky I am to be alive, and by some, this was a miracle that I survived this. These paramedics are the reason I am alive today. Again, thank you for your service, and I know that I could never repay you, but know how much I deeply appreciate this miraculous act performed.
Now, what a lot of you don't know is that I think we have to force these firefighters to be here, don't we, Dr. K? A lot of them, they don't want the recognition. They don't think they need the recognition. So they have to, you have to yell at them, right? To get them to be here. Okay, Amy, where is Amy Cooper? Where is she? Hi, Amy. Yeah, somebody has to force them to be here because to them, they're doing their job, but it's life-saving, and we're just so glad that you're here so that we can recognize you. And thank you, Donna Bias. Where did Donna go? Oh, thank you, Donna, and happy birthday. On April 6th of last year, medics were called to a tennis club and found Mr. Viet Nguyen on his back on one of the courts. Now, bystanders were doing chest compressions. Witnesses say Mr. Nguyen was playing tennis when he collapsed. The crew took over CPR and used the LifePak monitor to confirm that he was in ventricular fibrillation. When there was no change in rhythm after defibrillating at 200 joules, they turned up the power and shocked Mr. Nguyen again at 300. After another round of high-quality CPR, spontaneous circulation returned. A 12-lead ECG showed a normal sinus rhythm, but the crews noticed ST elevation in the inferior leads. They passed this information along to the awaiting emergency department staff at Mount Carmel East, and once he was stable, Mr. Nguyen was taken directly to the cath lab. Would Mr. Nguyen please come forward, along with the crew from EMS 16, Medic 32, Engine 32, Lieutenant Jared Wadsworth, Firefighter Michael Bernheimer, and Firefighter Jeffrey Couch. Please come forward.
Good morning. I'm very honored to be here today with you and with the people who have saved my life. And it was a miracle, actually. My story is like this, briefly. I was playing tennis with my coach, Bob, at the Scarborough Tennis Club. And I was suddenly down, unconscious. And it came from nowhere because I previously had no history of any heart issues, had no symptoms. And the people at the club, they had very quick action, performing CPR on me. Bob and Karen is here also. And my friends gone to the emergency quickly. And these amazing guys, they were at the tennis club within minutes. And that's all they could to get back me on life. And they brought me to Mount Carmel East Hospital. They had open heart surgery for me for up to 3 days. I stayed there for about 10 days and then 2 more weeks at the rehab center. And I was back to work after 4 months, and I'm here today with you. So it was really a miracle. And I know that I am one of the very lucky people who have survived this kind of extraordinary events. I have so many people to thank. First, I want to thank the first responders, my friends at the club. Of course, I have to thank the paramedics, amazing people. I will talk about them a bit later. And I have to thank my family, my friends. And I know that the paramedics, these amazing people, they have done everything perfectly to save my life. If something happens, they could not get to the club in time. They could not do things that get me back breathing, having my heart beating. And if they could not get me back to the hospital in time, I would not be here today. So I am grateful to you for the rest of my life, from my bottom of my heart. I will always remember about you. I always think about you. Thank you so much.
Thank you, Mr. Nguyen. This is the second time I've mentioned high-quality CPR. Is there any other kind? When Eric Stansifer made his dentist appointment, he most likely did not figure that he was going to wake up in the hospital, but there he was. Mr. Stansifer had gone in for a dental procedure when he went into sudden cardiac arrest. The quick-thinking staff immediately called 911 and began CPR. When EMS crews arrived, they took over chest compressions and placed the quick combo pads on Mr. Stansifer. He has already been intubated for his procedure, so the crew was able to give him oxygen pretty quickly. It took 15 minutes of, once again, that high-quality CPR before Mr. Stansifer had a return of spontaneous circulation. His follow-up 12-lead ECG showed a normal but rapid heart rhythm, so he was taken to the emergency department at Grant Medical Center. With Mr. Eric Stansifer, along with the crews from EMS 11, Medic 2, Engine 2, firefighter Ryan Moody, and firefighter Kyle Hunt. Please come forward. Oh, okay. Do you want to talk? No? All right. Well, Mr. Stansifer is not here, but we are so glad that at least these firefighters are here. So how about giving them a round of applause so we can thank them for their quick action? On September 19th, crews were called to a tennis club. What is it with tennis? It's the same one. Oh my, is it? See, this is why I don't do any physical activity. Because this is what happens, y'all. Crews were called to a tennis club where they found Mr. Joseph Hiles lying in the parking lot. His son, who was by his side trying to wake him, said they had just finished playing tennis and were walking to the car when he collapsed. His son, who was also a firefighter, thank goodness, noticed that his dad did not have a pulse and immediately began CPR. Bystanders from the tennis club grabbed the AED. His son put the AED in place and administered one shock. After the defibrillation, his son noticed a pulse and Mr. Hiles did become more alert. Initially, the EMS crew found Mr. Hiles breathing on his own with a strong radial pulse. He was put on a cot and given oxygen and taken to the trauma room at Mount Carmel East and ultimately to the cath lab there. Would Mr. Joseph Hiles come forward along with the crews EMS 16, Medic 32, and Engine 32, Lieutenant Michael Bernheimer, firefighter Simon Bonorigo, firefighter Jennifer Wilkinson, and firefighter Michael Walline. Please come forward.
This is great. I get to thank them twice publicly. Thanks to Councilman Brown and Dr. Kessick, I was invited Monday to the opening of the city council and kicking off the week honoring these men and women. You can't thank them enough. My story is, when Kim told her story, it was mine. God blessed me to be in the right place at the right time. I was with a firefighter. It's just, you can't find the words to thank these people, to save your life. I mean, it's such a gift. I'm sharing today with my beautiful family, and in case they don't know it, they're all part of my family now too. So I just want to say thank you, and you're beautiful.
July 13th, EMS found Mr. Chun An Chin on the floor next to his bed. His son was performing CPR. EMS took over the life-saving compressions, immediately administered oxygen with a bag valve mask, and connected Mr. Chin to the heart monitor. The rhythm showed that Mr. Chin was in ventricular fibrillation. The quick-acting crew delivered a shock of 300 joules, but to no avail. They attached the mechanical CPR, the Lucas device, administered cardiac drugs, and made repeated attempts to defibrillate him. 12 minutes after they arrived on scene, they loaded Mr. Chin into the medic and were headed to Riverside Methodist Hospital, where Mr. Chin's rhythm finally converted. He was still experiencing atrial fibrillation, but the crew confirmed that he had a return of spontaneous circulation. By the time they arrived at Riverside, Mr. Chin was trying to free himself from the straps on the cot. Would Mr. Chen, along with the crew from EMS 17, Medic 27, and Engine 27 and Ladder 27, Lieutenant Scott Ferguson, Lieutenant John Figgins Jr., Firefighter Joshua Plank, Firefighter Richard Backel, and Firefighter Timothy Hartshorn, all please come forward.
Yeah, I think today I can be here. I don't know how much grateful I need to thank all these firefighters as well as my family, my son, my daughter, and my wife. And then as a previous cardiovascular research scientist at OSU, and then because I never expect that will happen to myself, because the next morning my son has a swimming meet, so I go to sleep and need to wake up next day early. But when I went to the bed, and then that's what happened. Unfortunately, as my family as well as the firefighter crew, they come in to help me, and then I went to hospital. After 3 days, I woke up, I feel myself from the breathing tube, and within a week, I able to go home, and right now, I'm really, strong and moving to just to see, the next days. So thank you, all the crew that can, save my life. Especially I want to stress out is, as a cardiovascular researcher, I would say CPR is really important. And in this field, people did not spend too much time to focus on those, the CPR, because without survival, how can you cure the patients? So that I want to thank you, and then thank you everyone. Thanks.
So, Mr. Chen, why were you trying to, get out of the cot? Were you... They were trying to help you. They weren't holding you hostage or anything. What? Oh, you didn't know what you were doing? Okay. That happens to me on Friday night sometimes, so yeah, I feel ya. April 3rd, Mr. Anthony Marinaitis' co-workers told the EMS crew that he had been complaining of crushing chest pain and not feeling well for about an hour before 911 was called. His co-workers had him lie on the floor of his office, and when they went back to check on him, he was unresponsive. The EMS crew found Mr. Marinaitis lying on his left side with agonal breathing. They put him on his back and opened his airway. He took 2 breaths and then went into sudden cardiac arrest. The crew applied the quick combo patches and determined that Mr. Marinaitis was in ventricular fibrillation. He was first shocked at 360 joules before CPR was started. When Mr. Marinaitis' fatal rhythm did not convert after subsequent defibrillation attempts, the crew attempted a double sequential defibrillation, but no success. The EMS crew determined that Mr. Marinaitis met the ECMO CPR protocol, loaded him into the medic, and took him to the OSU cath lab, where the ECMO team was waiting for him. The team at OSU was able to get a return of spontaneous circulation, or ROSC. With Mr. Anthony Marinaitis, along with the crew from EMS 10, Medic 2, and Engine 2 come forward, Captain Scott Crummell, Firefighter Nathan Donmoyer, Firefighter Kyle Hunt, and Firefighter Brian Kissel. Please come forward.
Not one for speeches. I'm speechless. All I can say is thank you, gentlemen. Thanks to my friends and family in the office, friends and family at home, friends and family at the hospital that all supported me and prayed for me. Thank you guys. I got 2 little guys at home that we heard today.
Thank you so much, Mr. Maronitis. I think that that puts it beautifully, actually. Can we get another round of applause for our survivors for being with us today and being willing to share their stories? And then also for the men and women who saved their lives. Another round of applause for them. I love doing this because I love the stories. It's just so, it's uplifting and it's encouraging, and it makes me feel so lucky that I live in Columbus, where the best EMS folks are. I mean, without question, the best EMS folks are. So I know that if anything happens to me, I hope I'm here in Columbus when it does happen. I just hope it's here, because I know you guys are going to take care of me. If you don't, I'm going to get you. I'm going to get you, because I know that you're the best, and I know that you continue to be the best. And those of us who are here today, our survivors out there, and those of us who maybe someday may need your services, knock wood, we're just so grateful for the work that you do day in, day out. I know that you're humble, you don't want the recognition, you don't need it, but please accept it, because we mean it from the bottoms of our hearts. I have a dear friend that was a firefighter, retired firefighter. I don't know how many of you knew Bill Russell. Anybody know Bill Russell, Dr. Fire? Yeah. Well, he was a dear, dear friend of mine for 30-some years. I used to work with him and Mike Mullen on Firefighters for Kids. And then when he opened up his bar after he was retired, I think I kept it open. So we were dear, dear friends, and he passed a couple of weeks ago, and I went to the funeral, and it was great to see a lot of firefighters there. The equipment from Station 8, his old station, I think Station 1 or Station 2, I can't remember, were parked outside the church, and that was very gratifying to see, because till the day he died, he was a firefighter, a very, very proud firefighter. And we used to get into fights constantly, because we were too much like the same person, I think, in a lot of levels. And he would shut me up, though, by saying, you know what? You ain't got nothing on me. You can be on TV, you can be whatever. You ain't got nothing on me. Because when you're running out of a building, I'm running into it. So I just want to salute all you firefighters, medics, all you guys out there. And again, please tell the guys from Station 19 not to forget where I live. And now, that brings us to Fire Chief Calvin Connor. Chief.
I have the great privilege of representing and leading the best organizations in the United States, and that's Columbus Division of Fire, and as I like to say, Columbus Division of EMS as well. What you're seeing here is the exemplification of what 1,558 firefighters do on every given day. These firefighters and paramedics that you're seeing here, that were your caregivers at that time, didn't just do that on that one day. They do that 24/7, 365 days a year. And one of the things you don't see in the background is all the preparation and devotion and professionalism they gave to prepare for the emergency that you suffered so that they could offer their care and assistance. That's what firefighters, EMTs, and paramedics do in the city of Columbus on any given day. For the residents that are here, for the patients that we treated, we were glad we were there. But that's something we do 550 plus times a day. And the reality is that on 2 times a day, we see people in exactly your situation. One of the things that I saw as a theme from all of the stories you're hearing is how it took a community and a neighborhood and a village to make this safe. And that started with the preparation of these firefighters and EMTs and their professionalism and being able to respond. It started at our alarm office, where our people in the alarm office took that call in, knew how to initiate care immediately and dispatch the right resources, and where average citizens, friends, and neighbors stepped up and performed high-quality CPR on those patients. You're here today because everything went in line, but we can do better. Councilmember Brown is chairing a committee with Dr. Kessick on Heart Safe Columbus, that we're attempting to increase this every day. You heard Kimber Perfect say that the average person who suffers a sudden cardiac arrest only has about a 10 to 12% survival rate. One of the things that changes that is early CPR, and it can increase that person's odds by 300% by early CPR and AEDs. And that's something that we need every one of you to be an advocate for us as we go forward in that. Encourage your neighbors to learn CPR. Encourage your family to do CPR. The Columbus Division of Fire is here to offer our assistance. If you need instruction on that, you call our offices. We go to churches, we go to homes, we go to schools, we go to civic associations, and we also have classes at our training academy that you can come to us. What we want to be is that facilitator, but we need your help, because literally the same community, village, and neighborhood that saved your life needs you to help save theirs. So please help us with that. Encourage the businesses you go into to have an AED on site, to have their staff trained. These are the things that lead to a community having a success rate that, instead of having 600 cardiac arrests in Columbus with only about 60 survivors, we can change that to having 600 cardiac arrests in Columbus and having 180 survivors. That is a big deal. The family members that are here get a share, and the member gets to share for the rest of their lives because we were there. We need you to continue that. So I can't tell you the professionalism and thank you that I give to every firefighter, EMT, paramedic that I see sitting out here in the audience. I know that you are the tip of the spear, and you exemplify what 1,558 other firefighters do on any given day. So thank you. I can tell you we appreciate you, and we're trying to support you in every way we can. One of the things we have to understand is it took a lot of leadership even to get to this point. Dr. Kessick, I want to single him out, has been with the Columbus Division of Fire for 32 years. This is his last EMS celebration as our medical director. He started this program about 12 years ago. He has been a spearhead of this. He wants to be an advocate for this, and preventing cardiac arrest and providing the utmost in care is something that has been one of his advocacies his entire tenure. We want to thank him for everything he's done. He has set us up well, but it is now our turn to move on to the next step. And I think he set us up so we can continue to be success. You heard about some trials. The ECMO trial that I think was mentioned twice, and these survivors here, that is a trial because Dr. Kessick has set the Columbus Division of Fire up to be a leader in the nation in EMS care. That is a new trial that not everyone in the country has, but that's a trial that is showing remarkable save rates. When we can provide high quality CPR, we can get that patient to the hospital and increase their chance of survival. The survival rates that Dr. Kessick can tell you from that ECMO trial are second to none. I mean, it's the closest thing to a miracle this division's ever had. One of the things you see outside that he mentioned too is the Heartmobile that started years and years ago that brought cardiac arrest care to the patient. Well, the Columbus Division of Fire has partnered with the 3 hospital systems in a collaboration that on Tuesday will be announcing the mobile stroke unit that will be bringing that same care to stroke victims in their front yard. It will be a unit staffed with 2 Columbus firefighter paramedics and 2 people from Riverside Hospital that will be providing advanced stroke care there in your front yard. These are the things that, as an organization, and the professionalism that our members show every day, give them the ability to do and participate in. To every citizen, resident, and visitor to the city of Columbus, we're here for you. We're doing these things because it can make it better, but we need your help. And what I can tell you today is, like I said, be that advocate. Encourage CPR in your school. Teach all your friends and family. Encourage those businesses to have AEDs, have your churches have AEDs in their locations, because that's what will save 120 more lives in Columbus alone. And that's something that we can all work for. So I want to thank you for your support in the past with your dollars and helping the Division of Fire be funded, but help us now, because this is where you can be an advocate for us and help save a life. To Dr. Kessick, thank you for your 32 years of service. Thank you for being an advocate for EMS and driving us in the right direction. Thank you.
Thank you, Chief, for those kind comments. It's been a joy and a privilege to be associated with such a prestigious organization as the Columbus Division of Fire. And I would be remiss to say, or to not say, a few words about the other components of the leadership of our wonderful EMS system. Of course, Chief O'Connor, who has been a tireless advocate of improving the quality in our EMS system, but also our director, Dr. Ned Pettis Jr. In a previous life, he was a fire chief here. He was our fire chief here. And I remember that he welcomed me as medical director to a full-time position here, and really just gave me a sense of value and worth in providing the medical direction for the division, and also was a tireless advocate at improving our system to get where we are. So thank you, Dr. Pettis. Appreciate that. And then finally, Councilmember Brown, who has a rich history of being an EMS provider in Pittsburgh. He is working behind the scenes at City Council to improve our EMS system and also our cardiac arrest save rate with our Heart Safe Columbus program. So many thanks to you, Councilmember Brown, too. Yeah. So thank those folks. And then finally, you know, all of this would probably be much more difficult to accomplish if we didn't have the support of our local fire union here, Local 67. They provided us this great venue to have this event. They support us in what we're doing. And so I wanted to give the president of the local, Mark Seymour, a chance for a few remarks. For President Seymour.
I really don't have much to add. The speakers have been great, and the survivors, and hearing the stories are awesome. Mostly, I just want to say thank you on behalf of the members of Local 67. We are honored to open our building today for this event. It's kind of a unique event in the fact that we get to see the fruits of our labor. We get to meet up with the patients that we've helped change their lives, and we don't always get that opportunity. So I pledge to the locals' continued support, and have a good lunch.
I would also be remiss if we did not recognize our wonderful master of ceremonies today. You know, being a famous television personality as she is, and a great communicator, we do write these scenarios out, and there's difficult words there. I mean, and I think you would agree with me that she performed flawlessly today. In fact, I was particularly impressed, Angela, with how you pronounced that very difficult term, ECG. You did that great. And also, the other one I want to mention is CPR. That was, I tell you, you did a wonderful job with that. But really, I do want to just recognize Angela. She is indeed a treasure in our community. She's always willing to help, a friendly, smiling face. And she personifies, I think, the spirit of Columbus, that we're open, we're friendly, active, enthusiastic. Would you join me in giving her a round of applause? And just think, you won't have to put up with me anymore next year. Without further ado, I'm going to bring Reverend Ellsworth up for our benediction, and then we'll be ready for lunch.
You know, I keep coming back to these because I enjoy celebrating the giving of life, which you folks do when you give life. But I also come back with hope, because I always come back hoping Angela will relent and have a date with me. But she says she doesn't want to go with old men. And I age myself today when I recall being a part of the Division of Fire celebration of the Heartmobile. However many years ago it was, but I've had the honor of being connected with the finest Division of Fire in all the world for over, well, it has to be over 60 years. That's well before you were born.
Maybe not.
And it is great to celebrate where there is life that is given. And it is great to celebrate with the leadership that has been shown in the Division of Fire over the years I've been associated with them. From city administration, city council, the officers within the Division of Fire, and this young man over here who has been relentless in his pursuit, Dr. Kessick. Thank you for your friendship. Thank you for all you've done.
Thank you.
God bless you. Let's pray. Heavenly Father, when we read so much of that which is negative, it is great to be here today and celebrate the positive giving of service, the positive giving of love. The stories are translated into real life as the cardiac arrest survivors go out, continue to live, perhaps with a new appreciation for life, with a new dimension. We thank you for that. And we ask your blessing on all those who serve in the Division of Fire. Be with each one as each one provides service above self and makes Columbus and the surrounding areas the finest place to live. We thank you for them and ask your blessing on the continuing fellowship and the food, all in your wonderful name. Amen.
We can eat.